Depending upon your number, your corneal curvature is changed. The basic principle is to reshape the cornea, where we scan your eye and based on your eye, we give the specific treatment. It is not one fit to everyone. So out of this, which is more better for you, your doctor decides, and accordingly the treatment can be given to you. We are doing a map-based treatment, so that gives a better clarity, better contrast. Patient experiences better night vision. Femto is another machine where we make flap with laser. So femto contura means adding both the technology of femtosecond plus contura,
Okay.
which gives a better clarity of vision, better, safer procedure, and a faster recovery.
Hello and welcome to Health Unplugged, our superstars, the show where we bring you face to face with medical heroes and tackle situations or conditions that are easy to understand. I'm your host Deena from OneHealthAssist, your daily health partner to manage your records, your appointments, schedules, and reminder all in one place. Today we are tackling a topic that is confusing for most of us, that is a LASIK surgery. There are so many terms like standard LASIK, contour, femto, silk. So, to clear the confusion on which one is the correct one, to answer all our questions, we have Dr. Anil Yadav with us, who is an ophthalmologist and a specialist in LASIK surgery. So, welcome to you, doctor.
Thank you.
Doctor, let's start with the basic question. What actually is LASIK?
So LASIK is a laser-based surgery where we are removing the glasses, or we can say the refractive error of patient like myopia, hyperopia, and astigmatism. So in LASIK, what we are doing is we are reshaping the cornea so
Okay.
that the light entering into the retina gets focused on, I mean, into the eye gets focused onto the retina, and patients have clear vision without anything.
So basically, it's not like cutting off something, it's like reshaping the cornea.
Yes, it is not like generally cutting or putting contact lens, but we are reshaping the cornea based on your number.
Okay.
So depending upon your number, your corneal curvature is changed.
Okay.
And that is done so precisely with the laser so that you have a crisp and clear vision in a shorter time.
So that was a very nice way to clear a confusion on the basics of LASIK surgery. So basically, patient hear a lot of terms related to LASIK. So doctor, could you please walk us through different terms that are used for LASIK?
Okay. So as LASIK got evolved over years, there were different terminologies kept adding into it.
Okay.
So LASIK is the basic principle is to reshape the cornea, but to reshape, then now there are different modalities being used, like standard LASIK where we use microkeratome, which is a bladed procedure. Then came femtosecond LASIK, which is using a femtosecond laser to make the flap, so that
Okay.
bladed no blade touches the eye.
Okay.
Then to make a precise vision came contura vision. Contura vision is like having a map guided treatment where we scan your eye and based on your eye we give the specific treatment. Then there are another modalities like smile, which is flapless surgery, silk, which is flapless surgery. So there are different surgeries, but like it is not one fit to everyone. So out of this, which is more better for you, your doctor decides, and accordingly the treatment can be given to you.
So what I want to know next is how do a patient decide which is the perfect fit kind
So
of a
for that,
surgery?
patient has to visit their doctor. They should get their eye scanned. We need to see how's the corneal thickness, how's the corneal curvature, what is their daily needs. Like someone is into sports and all, they may need a different kind of technology.
Okay.
Someone who needs a crisper, sharper vision, they will need a different kind of treatment. So based on their lifestyle and their requirement, we decide which will be better for them.
So as a patient, doctor, does newer means a better treatment?
Not exactly. As I told you, every treatment has its own pros and cons. So, which patient needs which treatment will be depending upon what is their lifestyle, what is their requirement, and accordingly we decide. So, silk will have some other advantage, contura will have some other advantage. So, based on patient's requirement, we decide.
So based on the terms that you just mentioned, doctor, let's pause on contour. Can you just give us more brief
Yes.
on that?
So, like as I said, this is a evaluation of the procedure. So, initially we used to just put your glass number and we used to treat your number.
Okay.
So if you have -1, same treatment will be done for both the eyes. Like
Okay.
-1 will be, everyone will have standard treatment.
Okay.
But with Contura now, what we are doing is it is like having your thumbprint,
All
which
right.
doesn't match. So your thumbprint will not match to others'
Someone
thumb.
else.
Similarly, you have this corneal irregularity, which doesn't match to other eye itself, even if you have same number. So what Contura does is it scans your eye for almost 22,000 points. Based on those points, the irregularity is determined. and based on that the laser profile is created.
Okay.
So which not only corrects your number but also corrects the corneal irregularity so that you have a clearer, sharper vision.
Okay.
Okay.
So that's really nice for us to know how a eye scan or basic checking is really important
Yeah.
for us. So my next question is Contura a superior treatment, and what are the visible changes that a patient will notice?
So as I said, Contura, we are doing a map-based treatment, so that gives a better clarity, better contrast. Patient experiences better night vision, basically what is
Okay.
was lacking previously in the treatments. So less of glare, less of halos, and better contrast sensitivity. So they have a crisper vision, and which is like better than like normally 6 by 6 is considered to be a standard vision, which means patient has normal vision. But now we are going beyond 6 by 6, making 6 by 5, 6 by 4, like almost 30% of patient going undergoing Contura experience better vision like 6 by 5 and 6 by 4, which is a good thing to have.
It's really interesting to know that night vision can also be changed or altered in a positive way through these newer technologies.
Yes.
So that's really great to understand. So, sir, what is femtocontura?
So now you know Contura. So Femto is another machine where we make flap with laser.
Okay.
So initially, what in standard mic laser we used to make with the bladed thing. So blade has to have a lot of variations and a lot of complications which we hear about LASIK where because of those blade.
Okay.
So to replace that, Contura femtosecond is used, which has a precise laser which goes at that particular depth and creates a plane. So we
Okay.
don't have to cut it. With the laser itself, the plane is created, which is uniform, precise, and very accurate. So
Okay.
the healing is faster, recovery is faster. So femtocontura means adding both the technology of femtosecond plus contura,
Okay.
which gives a better clarity of vision, better, safer procedure, and a faster recovery.
So I want to add here that how technology can help a doctor and a patient to understand and treat the disease in a better way. So can you share us a story of a patient for whom you did a LASIK treatment, and how was the experience for the patient?
So LASIK treatment is a procedure where like you see all the patient next day with a wow effect.
Okay.
Okay. So like patient comes and they are like, sir, wow, morning first thing I could was like I didn't search for my glass.
Okay.
I could open my eyes and see the things so
Without the
clear and
specs.
so bright for the first time in my life. So
Okay.
that's a different feeling for patients. So we encounter every day same thing. Like history wise, like if I want particular patients, there was one patient who was very anxious. She was scared of getting LASIK done.
Okay.
Okay. So, but her parents wanted to get it done, and she was like, she wanted, but she was scared.
Okay.
Somehow we counseled her, she agreed to it, and same day evening, in fact, we checked her in the same day evening, and she could read 6 by 5 vision, and she was like, if I would have not done this, I would have lost so much of thing in my life.
Okay.
Okay, so that's
That's
something which,
that's really
yeah.
amazing. So now you all know, अगर आपको चश्मा नहीं पहनना है, so what you need to do, get a LASIK treatment done. As you mentioned that patient get little anxious to understand and really come up with the LASIK procedure. So how do a patient decide कि
See,
कैसे start करे?
so first thing is you understand what the procedure is, because there are so many terminologies, so many misinformation into the market and into the social media
Correct.
that it sometimes you undergo wrong information. So consult your doctor, get yourself evaluated properly, discuss all your questions with your doctor, discuss all the pros and cons about the procedure, and then you take the decision. So
Okay.
that will help you to decide what method you are going for, what advantage you are going to get with it, and so that will be a better thing.
As doctor just mentioned that consultation is a very important aspect here. So platform like One Health Assist is going to be very useful because on One Health Assist platform we have different doctors, specialized doctor with whom you can connect online, offline, and even a walk-in visit. So you can choose your consultation wisely with a specialist doctor and get a proper treatment. So talking about the technologies here, doctor, I want to know how Contura is done on which type of a machine.
Okay. So for Contura, we need specially Alcon platform. So EX500 is their excimer machine, which only offers Contura. No other machine will offer Contura
Okay.
because that is the software developed by this Alcon people. For femto, we need a separate femto machine.
Okay.
So if you are doing femto contura, you need two separate machine. One is to do the femto and then shift the table to the excimer laser of Alcon EX500. Other platform, if we have another machines, so they will have their own software, but not contura.
So, for a layman term, the patient should not shy away from asking any
Yes, yes,
questions,
yes.
correct? In
The
terms
patient
of,
should know which machine is being used at that center so that they are aware like what technology will be offered to them, because every machine has their own software, their own treatment pattern.
okay.
So based on that, the patient will be in a better position to decide.
So, are there any specific clinics or hospital who would be doing this, or how is it?
Yes, like in Mumbai or in India, there are many centers which have this Alcon platform which offers Contura.
Since we are talking about technologies related to LASIK, what next I would like to know is Contura better than the Smile?
See, like as I said you before, also all these technologies have their own pros and cons. So the pros for Contura is you have a better night vision, clear vision, better contrast. Pros for Smile is you have a better corneal strength.
Okay.
But saying that, it doesn't mean that in Femto Contura you don't have good corneal strength. One thing still lacking in Smile and Silk is the irregularity correction.
Okay.
So here in Smile and Silk, what we are doing is we are correcting number wise. Like if you have -1 number, this much tissue will be removed. -2, this much tissue will be removed.
Okay.
But in Contura, what we are doing is we are mapping your eyes, and based on your irregularity, even the higher order aberrations are corrected. So which gives better clarity of vision. But still saying this, I will always say that we need to evaluate patients. Some patients who are into physical sports or into army, so for them, Smile and Silk may be a better option. For
Okay.
people who are into IT, into software, or they need more color contrast, for them Contura will be a better option. So that is like doctors and patients discussion. Based on that, we need to decide which will be a better option for them.
So here what I want to add is that it's not a specific treatment that is given to each and every patient. So there it's a customized treatment that you can get for your patient, and platform like One Health Assist is definitely going to help you because doctor will be directly connected to you and you can ask whatever questions you have. Let's clear a confusion on few basic things. So sir, LASIK is painful?
No, it is a painless surgery which happens in 10, 15 to 20 minutes for both the eyes.
Okay.
And patient walks out of operation theater with open eyes.
Okay. So there is no hospitalization that is
Nothing.
needed.
Same day, like within half an hour, patient can go home.
So the very next day, the patient can start with the routine.
Yes.
So doctor, can LASIK make a patient blind?
So not even a single case in the literature has been noted down from the olden days. So now the technology is so advanced, so sophisticated that the possibility of that is almost zero.
So does every LASIK treatment mean same?
The basic principle is same, but the treatment varies depending upon
Okay.
what modality of treatment we are using, from standard, basic, femto, contura, smile. So the technology differs, and based on that, your correction or the result will also differ. So it is not the same fit for everyone. It is, we can say, customized for every eye, not individual every eye.
Okay. So is it specific for gender and age also?
It is like above 18 to around 47, 48, we have a better result.
Okay.
Before 18 we don't do, and after 48 patient starts getting cataract, so it is better
Right.
to avoid.
So doctor, let's start on a personal question.
Mhm.
How did you develop your interest on studying ophthalmology?
Yeah, I did my MBBS from KEM Hospital, which is
Okay.
one of the reputed hospital all over India. So when I started, Ophthal was not such a developed thing. It was into a developing stage
Okay.
where every 2 months or 3 months there was something which was getting added up into the field. So that fascinated me, like newer technologies. Always I had more passion for or fascination for these technology things. So that way I got inclined towards ophthalmology. I was one of luckiest person to work with femtosecond platform in Dr. Agarwal's hospital in
Okay.
Chennai in 2006, when the first femtosecond LASIK came. I did my first, we can say, live femtosecond laser surgery in Mumbai in 2011, and I'm doing this LASIK since 2000. I mean, say, can 6. So
Okay.
it's almost 2 decades now. A lot of ups and downs. I have seen patients, I have seen all types of patients. And one thing, as I say, the wow thing, what every surgeon wants from patient, you get only in refractive surgery.
So that's really impressive to understand that doctor is in this industry from last 2 decades, and we have specialist doctor on our platform. So that's great. So doctor, from last 2 decades, how many successful surgeries have you handled?
So in LASIK, almost like we have 99.9% results. So all the surgeries are successful. Few patients may encounter some complications which are easily manageable. So I don't remember anything where drastically something would have gone wrong,
Okay.
and like most of the patients are doing good.
Um,
Since 2006, it's almost like almost 2 decades now. On an average, even if I consider two surgeries a day, it will sum up to almost more than 15,000 surgeries till now.
That's
So
phenomenal, sir.
we have stopped counting now how many surgeries.
So, as we just heard about the success stories with doctor, what we want to know next is compared to 2006 to till date, how do you see a difference in the opinion of a patient or experience of a patient in terms of technology?
So there is a vast difference, we can say. Like in 2006 and era, patient were like what you say, they used to get it done.
Okay,
Okay, so lack of information was one thing. Like patients were not aware. They wanted to remove their glasses. They used to come, get their glasses removed, and go
that's
happily.
it. Okay,
Okay, but now what we are seeing is now this generation is well aware. They have lot of, we say, medium for everything. So they research and come to us. So they have all their questions ready. They have all their answers also ready.
okay.
They cross question us about things. So we ourselves have to be at our toes. And the technology is also improving so fast into ophthalmology that we have to update ourselves every 6 months, we can say.
Okay,
Okay. So it is, yeah, it's good thing, like patients are aware. So our work is less that we don't have to explain much. They know things.
okay.
In those days, we have to sit with the patient, explain them, make them understand. So our work has become less, but yeah, then our answering the question has become more.
So as we just heard that Google help तो कर देता है, but you cannot decide your treatment with Google. So consult with the correct doctor. Doctor, as you just mentioned that LASIK requires checkups, follow-ups, appointments. So how do you see platform like One Health Assist helping you with that?
So One Health is like a very good platform where you can have all your pre-operative records stored, your scans stored, as well as you have this follow-up reminders and you have online consultations available.
Right.
So this is a great platform in this era where you have lack of time and everything is available in the soft copy format.
Right.
Okay. In fact, I used to tell my patients those time, like you scan your report, save it into your mail, because in LASIK what happens, we are doing LASIK in a young age.
Right.
In old age, when you turn up, like when you start having cataract, that time you may need these scans, which is handy. If it is available, it will help too much to the doctor in calculation your lens power and all. So platform like One Health, where you can store your records and everything, that is a great thing to have.
So that's really good to understand that health repository is a very good aspect on One Health Assist platform, because on health repository you can store all your medical data, scan prescriptions, everything, and it's easily available. Dr. Anil Yadav is available on One Health Assist. So if you want to consult regarding a LASIK treatment, you can very well do it on One Health Assist platform.
You can log in onto One Health Assist and you can book my appointment. For LASIK, we need to evaluate you first because not every patient is suitable for LASIK. So we need to be 100% sure whether your eyes are eligible for LASIK, and if it is eligible, which method will be better for your eye. For that, you can always contact with One Health Assist or at Arohi Hospital, as we are part of One Health Assist.
Thank you, Dr. Yadav, for
Thank you.
creating awareness on a topic like LASIK surgery. It was really nice of you to give us
Same
deep
here.
insights onto this topic.
Thank you very much.
From managing medical records on One Health Assist or getting the consultation with top specialists like Dr. Yadav, OHA helps you to take charge of your health with confidence. I'm your host Deena, signing off from now. Till then, stay curious and keep asking more questions.